Good afternoon. Today is Friday, March 27th. I'm Tanya Cole, Assistant County Manager. Joining me today is Chairman and District 1 Commissioner Pete Meitzner, as well as Health Director Adrian Byrne. This afternoon, I'd like to go over confirmed cases as of March 26th. Number of confirmed cases in the United States increased from 69,197 to 86,012. Number of confirmed cases in Kansas increased from 126 to 168. Number of confirmed deaths in Kansas, 3. That occurred in Johnson and Wyandotte counties. Number of confirmed cases in Sedgwick County increased from 16 to 21. Number of confirmed cases in periphery counties, 3 in Butler County, 4 in Reno County, and 1 in Harvey County. As I mentioned, as of noon today, Sedgwick County has a total of 21 cases of COVID-19. You can go to our website, www.sedgwickcounty.org. There are tables on this website with information related to our Sedgwick County cases. I'll now turn it over to our Health Director, Adrian Byrne.
Good afternoon, everyone. So there's some confusion around testing sites versus swabbing. And I think it's best that we all refer to them as testing to clear up some of that. But what we actually do is swab people. So when you hear or read that Grace Med or a clinic or Wesley or Sedgwick County Health Department is testing, it means that we're actually swabbing people and then sending them off to the labs where they actually test the specimens. So yesterday we swabbed or tested 16 residents for COVID-19. And as of 8:15 this morning, we have 14 appointments scheduled. So I imagine there are more scheduled to go through and be tested this afternoon at our location. And this is done by appointment only. And any resident that believes they have come in contact with someone that has COVID-19 or believe that they have the symptoms themselves, please contact 211. And they have staff there that will screen for criteria to be tested. And if our Sedgwick County resident meets that criteria, then they will connect you with our own nurse triage line at Sedgwick County Health Department, and then they will ask similar questions again. And if you meet the criteria, then you'll be scheduled for a time where you can come in and be tested. We have defined that we have community spread now, and since it's a new and ever-evolving issue, there's not like a best practice for COVID-19 of when you decide you have community spread, but we define community spread as 5 or more cases that are not related to travel, and we are at that threshold now that over 5 of our cases were not related to travel, so we are calling it community spread. And the community spread means that we're not able to identify exactly where they came in contact with it. So if we know they haven't traveled, and they also can say that they've not, and we know that they've not been around someone that we've tested that is positive, then that is what is defined as community spread. Translation, materials, and information. We're working to have our resources on our website, Sedgwick County Health Department website, translated into Spanish and Braille, and we'll also be looking at translating that into Vietnamese. Additionally, we continue to work to provide an ASL translator at our daily briefings and press conferences. Over to you, Chairman Meisner.
Okay, good afternoon, everybody. Just a quick reminder that we are in the third day of our stay-at-home order. Basically, it is to help, obviously, stop the spread that Adrian just referenced, because it is locally around us. With that is a review of the essential and non-essential businesses and services. Our staff has been fielding, in our legal department, and staff have been fielding daily inquiries from citizens and mainly businesses to determine and validate if they are essential or not. as a business and as a service provider. Among that, one of the stay-at-home orders included around the country. We've consistent with it includes movie theaters, and including the Starlight Drive-In, which is and are not operable. I know that the county manager has talked to the owners of the Starlight Drive-In, and they will not be open over the weekend. Again, this order was created for residents to stay at home to slow the spread of the novel coronavirus. On another note, we've been meeting with all of the grocery store owners and groups from around the region. We have determined our website at Sedgwick, www.sedgwickcounty.org. You will find a list of stores with special hours for older adults, 60 plus, or those who are most at risk for COVID-19. This information is current as of March 25th, and we will continue to update that. It'll be on the community resources section, and so you can click there and see the hours of operation. Again, all of the major grocery stores have been in contact with us, and we notice that they even are putting pieces of tape down and notices to try to keep you in line at least 5 to 6 feet away from each other. And they will be asking for simple things like maybe just 1 or 2 members of your family enter, so they'll be practicing all of the orders of public gathering. And so that is a little bit of an update. Again, if you have any questions, 660-9000, but you'll get reminded of that again. So, and with that, I'll hand the microphone back to Adrienne Byrne, our health director.
And those things, the social distancing is crucial, of 6 feet, and as well as washing the hands and keeping the hands away from your face. Those things can help save lives, will make a difference and help save lives. It's important to remember last week we had 1 case, now we have 21, and those are going to continue to increase. And so those examples of what you can do and guidance of what you need to do is really crucial for yourself and for the community. So donation requests. If you're a business and would like to offer support donations to keep our public safety and healthcare workers safe, let us know. We have already had many businesses reach out to the county, and we greatly appreciate that. We are seeking protective face masks, N95 respirators or surgical masks, non-latex medical gloves, hand sanitizer, surface cleaners, non-permeable fluid-resistant gowns, nasal pharyngeal specimen collection swab and viral transport medium. Those are the swabs that go up into the person's nose to collect the sample, and then the viral transport is what we put that in so that it can stay moist while we get that over to the lab. Contact Sedgwick County Emergency Management at 660-5959 to donate.
Okay, and in closing, we'll go back to Tanya Cole. Again, we've had a number of groups wanting to donate, and they've had a number of groups that have wanted to manufacture. And so we are working diligently with all those groups, and thank you for the community for coming forward with that. And that, again, that number, if you wanted to be a part of that, our Sedgwick County Emergency Management is trying to coordinate all of that information and all these volunteered services and supplies. 316-660-5959. 660-5959. And in closing, back to Tanya Cole, please.
Thank you, Chairman. And I know we're going over a lot of phone numbers and information, but I've got a few more. Again, if you have any questions on the stay-at-home order, questions if you're essential or non-essential, please call this number, 316-660-9000, or email stay-at-home FAQ, that's stay-at-home FAQ @sedgwick.gov. If you have any questions about COVID or if you think you need to be tested, please call United Way of the Plains at 211. And again, our website, www.sedgwickcounty.org, has all the latest up-to-date information. Please go to our website. Thank you.